So type 1 diabetes is an autoimmune disease where the patient's immune system destroys the insulin producing cells in the body. So type 1 diabetics actually have no to little ability to make insulin on their own. So they have to rely on taking insulin shots.
So our invention is making a line of human pluripotent stem cells that are minimally immunogenic. So this means that we've made a cell line that can differentiate into almost any type of mature cell type, and we've removed all barriers of immune recognition from it, so other cell types cannot see it, cannot interact with it, and cannot kill it.
So basically what these cells are they're sort of a primitive cell type that you can coax into becoming really any type of adult lineage. But they're essentially a nice template for you to be able to generate the key cell types that you think has some therapeutic value.
So prior to implanting our invisible cells is when we differentiate them into the beta islets. So the cells that will actually be transplanted into the diabetic patient will already be a beta cell producing insulin. Typically for cell therapies, patients need to be treated with immunosuppressive therapies. So this can be highly toxic to the patient. It can also increase their risk of different types of infections or cancer even.
So by making these cells non-immunogenic, you're addressing not only the scalability challenges of being able to manufacture treatments for all patients without anti-rejection drugs, but this immune masking will also allow the cells to survive even in patients that have this autoimmune disease.
So with our technology, by putting in beta cells, they would practically look like the beta cells that a type 1 diabetic's body has already destroyed. So they would be going back to a state that would be similar to being pre-diabetic. We're putting in cells now that can readily detect what your glucose level is. You eat a meal, they can sense, hey, blood glucose levels are going up, and they'll go ahead and crank out the correct amount of insulin for you.
And even though it's obviously a disease that can be managed at this point, you sort of just recognize the impact that it has on people's lives and families, and just the enthusiasm and passion that people who have type 1 diabetes in their families have towards this level of research and the potential cure is really inspiring, more so than the dollars.
Again, while we hope to target type 1 diabetes, I hope for a cure in that area. So I have a personal interest in this project, not to be selfish, but I am actually a type 1 diabetic. The thought of having a cure, especially one that does not require immune suppression, the burden of everything would just feel lifted.
As you can imagine, this technology has the potential to impact not only type 1, but as I mentioned before, it can also be used to treat a variety of diseases where a replacement cell has a benefit. So there's 2 million people in the US and 9 million people globally that have type 1 diabetes. And this translates to a roughly $10 billion market with an annual growth rate of around 13%.
But really what we're looking for are investors who are committed to this, understanding that it's a long road to develop a new cell therapy, but also are excited by where we're at and understanding that the potential for what we're trying to do here is really huge. So those are the kinds of partners and investors we're really looking for.